Hey everyone, it's Russ Curtis, and I'm with Katie here. Katie's an experienced clinician with a lot of training under her belt, including EMDR, CBT, addiction training, and so forth. And we're going to talk specifically now. This is just a role play scenario of how a behavioral health provider or a counselor would work with a medical professional in terms of just talking about clients and their medicine. So, how do you best kind of coordinate with medical professionals to best help the client? And I'm going to be playing the medical professional here. Obviously, I'm not a medical professional. So just know that this is a role play only. And Katie will be the counselor. Um, all right. Katie, yeah, you wanted to talk to me about a client who's on a lot of medications.
Yeah, thank you, Dr. Curtis, for making time. I wanted to talk to you about Al. I was meeting with him today, and it just became really clear he's not really able to keep up with his medications. And clearly, I'm not a prescriber, but when we were just looking at his list to kind of brainstorm if something could be helpful, he's taking 12 medications. And it just became real clear to me that it's like confusing and overwhelming, and he doesn't have a lot of support at home. So I was really hoping just to pick your brain about, is there anything that might be helpful with this long list? Is there anything we could do to simplify it? And whether that's you take a list, take a look at the list, or I could join at your next appointment, whatever would be most efficient for you, be super helpful.
Okay, I appreciate that because I've got a client waiting for me now. But yeah, let's look to see if we can do that at the end of the day, and we'll take a look at their medication. I know they're on a lot of them, and we'll see what we can do to maybe reduce. But yeah, I appreciate you asking about that.
Yeah, thanks so much for making time.
Yeah. Um, okay. And we're just going to kind of roll right into this, but I'm a medical professional now who is not really on board with clients using medication assisted therapy, such as Suboxone. Um, and you're the behavioral health professional who's probably seen that this client's doing a lot better, staying out of the hospital, maybe staying employed on it. And so, how do you talk to the medical profession about medication assisted therapy?
Yeah. Dr. Curtis, it sounded like you had some concerns about the person we both saw earlier.
Well, yeah, I mean, we've got them on several medications, but they're also on Suboxone. I realize they've had a history of opioid abuse, but I'm just not comfortable with them being on that long term. Uh,
Yeah, you're just wondering like how long is he going to be on it?
yeah.
Yeah. What we know about Suboxone, and I'm sure you probably know more than I do, but that when people come off Suboxone, that's the most likely time for them to relapse and then overdose because they haven't been using, so their tolerance is really low. And for Jimmy, he's got a lot of stressful things going on right now. His mom is sick. He's trying to find a new job. And so if he were to choose to come off of Suboxone, we'd want to do that in a time when, things aren't quite so stressful and he really wanted to do that. So that's one piece. I don't know if you knew that he had all that stressful stuff happening right now.
No, I didn't. I didn't. I only had a few minutes with them. Obviously, we've got a lot of patients coming in and out. Okay, well, we'll just keep them on it for now, and then we'll meet in staffing a week from now. We'll talk about it more.
Yeah, that sounds good. I know he's on that his diabetes medication too, and I kind of see it that way. Like he might need that medication his whole life, and he also might need this one too.
Yeah, that makes sense. All right, well, and we'll just keep rolling with this, Katie. Is the last maybe scenario is you've got a client who's having some side effects, possibly wanting to change their antidepressant medication, and you're advocating for the client as the behavioral health professional, as the counselor, and how would you talk to me as the medical professional who's really only got about 15 minutes with clients throughout the day? Yeah.
Yeah, yeah, that sounds good. So I wanted to talk to you about Bethany. Bethany's been taking her antidepressant for a while, and she's really describing that there's some side effects that feel pretty uncomfortable to her. And I know that my worry is that she'll just stop taking it like cold turkey. And we know kind of where that's gone before, how deep in depression she gets. So she was hoping to kind of talk through with you like what the options are, what some of the side effects are, so that maybe she could really even think about what a plan might be, even if she doesn't make a choice right now in this appointment today. So I was wondering if you would have a chance in your appointment to really go through her concern about these side effects that are making it really uncomfortable and lowering her motivation to take that med.
Yeah, I definitely want to hear this, but I know that this is her third round of antidepressants. It seems like this is a pretty common uh, argument that she has, and so I'm starting to maybe run out of choices.
Yeah, yeah. Well, let me say you are not wrong. This is the third time this happened. And it kind of comes up with Bethany that she has a little bit of side effects or a struggle and gets pretty focused on the medication and change. And I know that last time you kind of rolled with her, like you really heard her out, and just gave her options. And if it seems like you did a really great job of that before, if that's something that could happen again, even if it's that, hey, these kind of are the options that we have when we're running out, if that's real. Like, I thought you did a great job of sharing that with her last time. And I appreciate your patience with her. I think she does get a little impatient about her medications and, but also pretty uncomfortable with some of the things that she's experiencing.
Yeah, nice, nice. So, okay, nice job. Again, everybody, this is just a role play of how a counselor might work with a medical profession and kind of advocating for their clients in terms of a medication change. And I think Katie was again trying to demonstrate how to join, just as we do with clients, join with the medical professional, recognize that they've got a busy, hectic job, and that it's very confusing. To get all this right. Not that there is a right. So I thought Katie just did a nice job of demonstrating that we have to be every bit as conscious of building relationships with the medical professionals as we do with our clients.